My name is Ron Chambers, and I'm the Family Medicine Residency Program for the Methodist Family Medicine Residency, and then I'm Medical Director for our Medical Safe Haven clinics for victims and survivors of human trafficking throughout the healthcare system. Back in 2014-15, different people working against trafficking in our community, from social work, child protective services, law enforcement, you name it, they basically approached healthcare. And they said, you know, we're all dealing with this issue in our society and you're kind of last to the table to help and we need your help. And it's nice to be able to say that Dignity Health really kind of stood up to the plate and created an incredibly robust human trafficking response program. Very few and far between hospitals and hospital systems adopt this work. These are individuals that have days, weeks, months, years, even decades of trauma, of abuse, of exploitation. And to think they don't need our ongoing help from a healthcare perspective and a behavioral health perspective is just, it's very naive. While we were starting this work to be able to identify people within our system, we also concurrently established within our residency program what we called a medical safe haven, where we could bring these identified patients over and provide that longitudinal care, care for them, their children, deliver their babies, take care of them when they get hospitalized, the whole gamut, all in one spot within our family medicine clinic.
So I'm Gigi Barrios, and I'm the Medical Safe Haven Senior Program Coordinator for all of the Medical Safe Haven locations throughout the state of California and now also in the state of Arizona. A lot of the individuals that I was supporting didn't have any established care anywhere. I was personally taking people to urgent care, to emergency department, because they didn't have ID cards, they didn't have social security cards, they didn't have insurance, and that was their go-to. So it was one of those things that we would feel like, okay, we'll cross that bridge when we get there. But a part of our intake was never, hey, do you have established care somewhere? Can we get you just to get a routine check? It was one of those things that if I need to go, I'll go, but it's nothing I care to invest my time in right now. And so when Dignity Health came to us, when they were thinking about launching this program, they asked us, is this something that you feel would be helpful for you and the clients that you're serving? So we said 100% absolutely yes. The clients, however, at the time, they were still a little skeptical. They still, didn't have a lot of trust with the healthcare system. And so that's where we really stepped in and came in. We built a relationship with Dr. Chambers and his team. We heard their vision for the program. They also brought survivors to the table and said, what can we do better? What has your experience been like? How can we make sure that when we are seeing patients, we don't re-trigger, re-traumatize them, or give them the same experience that they've had in the past? And so that really was a game-changing moment for everybody, where then we believed these doctors, we believed Dignity Health and what they were saying and what they were wanting to do with this program, and so we could vouch for it. We could then meet with our clients because we were the ones that had that established rapport and say, hey, we trust them. And so then they would be like, okay, I'm gonna give them a shot. And just to see the look on their faces after that first visit of saying, no one has ever cared about me in that way, or I've never felt validated in the healthcare space, I've never felt seen, was absolutely just game-changing for all of us.
Family Medicine Residency Clinic here in Sacramento is the highest volume center in the country doing this work. We far and away have the volume and the experience taking care of this patient population that truly just doesn't exist in medicine in this country. We have over 8,000 patient visits. If you add in maternity care and patient care, it's probably well over 10,000. And so the kind of beauty of this process is, if you think about what that means for the residents in training here, our doctors, our staff, they have this incredible experience of going through trauma-informed care training, human trafficking training, but then they also get the hands-on experience of taking care of this patient population and really seeing those lives transform. What it leads to is the residents who graduate from this program, they are the leading experts in the country on taking care of these patients. There's very few doctors, even the leading experts in the country, that have taken care of anywhere as near as many patients as any one of our graduates do. And then they go into their communities when they graduate, right? And they know how to identify, respond to, and appropriately treat this patient population.
My name is Dr. Sarah Chafin. I had the privilege of training with the Medical Safe Haven as a resident physician in family medicine here. and then moved on to become one of the faculty physicians within the Medical Safe Haven. If we can break down the stigma that being a victim, or a survivor for that matter, of human trafficking is a character flaw, I think that would go a long way in understanding how something like that happens, and that what the road to recovery looks like. That was the biggest thing for me, is I had so many misconceived notions or just wrong perceptions about people who have that trauma history. Being a victim or a survivor isn't a character flaw. These are not bad people. They've had really bad things happen to them. I think that stories and narratives and trajectories can change. I don't want people to focus on the statistics and just be fearful about this issue, that it could happen to them or their loved ones or anything like that. It's important to stay aware to prevent those things from happening, but that for those who it has already happened to, there is a way to recover, and that we don't have to be doom and gloom about it. It is difficult, and the road is not linear, but I think there is hope for each person. Medical Safe Haven is a vehicle for us to really drop our egos down to the ground and say, we're all learning together. I have a few tricks up my sleeve when it comes to medicine, but otherwise, we're a team, and we're going to figure out how to get you where you want to be.
It's all grant run, grant funded. Unfortunately, there's no funding for this type of work. You know, it's not built into the economics of healthcare systems, and so we rely very heavily on you know, the generous donations of our partners and our, you know, funders.
Our program really ensures that we remove all barriers if possible, so that when an individual comes in, they have to deal with very little. So for example, if they're coming fresh off the streets, their ID has been confiscated by their trafficker, they have no type of health insurance, we can still see them. And that's really brought in by, you know, those donor dollars, some grants that we also are able to apply for, and we get, thankfully, because, you know, that's the reality. They need primary health care, and sometimes it takes a while for them to establish health insurance. And we have our incredible advocates that work with our patients to eventually get them, you know, on that road to be able to access those resources. But in the meantime, we can still see them, you know, if they call us and say, hey, I want to establish care, but I don't have this or that, we say, we'll still see you. We're still going to get you support. We partner with labs, so like Quest Diagnostics. We partner with pharmacies in the area that give us a reduced rate to be able to provide medications if needed, imaging, and labs to these patients while they work on getting their insurance. So one way that viewers can support our program is through our Mercy Foundation, and getting in contact with them and letting them know that they are interested in supporting the Medical Safe Haven program.